So now I would like to show you induction of still point. Still point we can, like a therapist, induce everywhere in our body, but mainly we induce still point on the feet, under the sacrum or around sacrum, and on the head. And on the head is called CV4. CV4 means compression of the fourth ventricle. In Upledger Craniosacral therapy, in 10-step protocol, we use induction of still point at the beginning and at the end of this protocol. And at the beginning, we use it because we would like to regenerate our craniosacral rhythm. If at the beginning we evaluate that there are some differences, it means that the rhythm is asymmetrical, or you can feel some differences in each part of the body. So sometimes it's explaining, like if you are working with computer and the computer is frozen, so you can also push the button to switch off the computer, and then you hope that the computer is turned on in the right way. So still point is like turn off the button on the computer, that the craniosacral rhythm is going to be symmetrical, deeper or wider, etc., etc. And at the end of 10-step protocol, we use it because sometimes it's good for integrity, that if you are going through treatment, you put some information in the body, and through the technique, the information is going deeper in the nervous system or stabilized nervous system. And also, if you don't know what you did through that 10-step protocol, or you feel that the patient is going through some somato-emotion release, it's a very calming and relaxing technique. So there are many indications for still point. Also, we can use it for example, for acute pain, for fever, or for labor pain. It's for that diagnosis or for that indication, it's important to repeat still point every 15 minutes. And for example, in my practice, I also use still point for people who are very tense, who have very big hypertonus. And there are many other indications. So I will show you on this model still point induction on sacrum and on the head. So on sacrum, the position is that your hand is below the sacrum. Then I will show you on someone of you. You are in a very comfortable sitting position. It's good that you feel the background, your spine is straight. And you try to feel craniosacral rhythm, which means flexion towards the feet and extension towards the head. So it's good to really feel the rhythm, to be in it or tune in it. And induction of still point means that if the body is going to extension, you are following this cycle or this rhythm. Then it's neutral pose or break. And afterwards, the body should go to flexion. But you, like a therapist, you don't follow this movement. You can put a little bit resistance against it, or sometimes I'm switching off the radio in my head for craniosacral rhythm at that time of flexion. And then there is other extension. So you are following extension, then it's neutral zone or break, and then you are switching off your radio in your head for flexion, or you are putting a little resistance against it. And you are doing it so many times until the rhythm stops. It means that you don't feel any flexion and any extension. You should stay with it for 5 minutes, or until you feel that the resistance in the body is really big, so you cannot hold the rhythm anymore. So you release the holding, and you can feel that many times you can feel that the rhythm is bigger or is more symmetrical than before. So the end of induction of still point is you again feel the rhythm in flexion and extension. So you follow the rhythm in physiological way.